Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.
So I always found that I had difficulty breathing through my nose ever since I was a child. And it was something that my parents looked into from an allergen standpoint and didn't find anything.
You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Palladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. A gentle disclaimer. Please do not consider anything discussed on this podcast by myself or any guest of the podcast to be medical advice. The information is provided for educational purposes only and does not take the place of your own medical or lactation provider. Thank you. Welcome back to the Tongue Tie Experts podcast. I'm your host, Lisa Palladino, and today I have a very special guest who actually reached out to me to share her story, and I'm very grateful for that. Noa Bricklin is a New York City-based creative director, production designer, and wellness brand consultant. She works in film and television and holds an MA in art history and social anthropology from the University of St. Andrews. She is currently the editor of the Holistic Edge podcast. Welcome, Noa. And you're such a different type of guest than we usually have. My listeners are probably saying, why is she talking to a creative director, right? But you reached out because you have a lifelong health concern that you've discovered was related to your tongue tie, and you've had a journey. So tell me a little bit about that.
So I discovered my tongue tie was diagnosed in 2017. At the time,
and how old?
At the time, I was 23, so I just finished university.
Okay,
and I didn't go looking for a tongue tie. I honestly, the first time I heard it, I thought it was a joke as a diagnosis. But I had started to have a couple different kinds of symptoms that all felt they were related to my airways. I kind of knew intuitively that I wasn't breathing as well as I could be. And I started sort of trying to go down that rabbit hole. I eventually found an ENT who took a look at everything and said, your mouth is not structurally where it should be. So I then found Dr. Barry Rayfield, an orthodontist, who told me that I had a tongue tie.
Now, when you say that your breathing wasn't what it should be, to me, that's a red flag that I want everyone to connect with tongue tie because, well, first of all, I'm working on an amazing project, a documentary called Breathless about airway. And it's by the Airway Revolution Foundation, which is a nonprofit. And I've been chatting about that a lot, and you'll hear, my listeners will hear much more about that. But the breathing aspect is not how I started in this field, right? But what were the symptoms for you that made you think, I don't think I'm breathing right?
So I always found that I had difficulty breathing through my nose. Ever since I was a child. And it was something that my parents looked into from an allergen standpoint and didn't find anything. I saw this ENT when I was 23, and she did one of those things where they stick a little camera up your nose. And she said that I had very, very thin turbinates, and it was very narrow, and that she thought it was related to how my jaw was at the time. Her husband was an orthodontic surgeon, and he took a look as well. And he said pretty much that the two were very connected. And what we determined later on, it took another 4 years to put this together, but owing to my tongue tie, the top of my palate didn't form correctly. So it didn't have the tongue as a brace to kind of form around it. So it grew very narrowly. And as a result, my nasal passages were underdeveloped, and I was actually suffocating myself. So anytime I tried to breathe through my nose, my nasal valves would collapse in on themselves. And so I couldn't take a full breath. And for me at the time, I was like, oh, well, I'm just a mouth breather. Like some people just breathe through their mouths. That's why we have two places we can get air from. And of course, now I know how damaging that is.
Yeah. So just for those who don't, let's like back up a little bit, because you just said so many key ideas you just described to us that not everybody may understand the connections to. So it's so strange. I just gave a lecture last night about how the palate is formed, and it starts with breastfeeding, right? And this is not to make anybody feel bad or make your mom feel bad or anything like that. We do the best we can, what we know and what we can do, right? But if the palate has an artificial nipple or a pacifier against it regularly, the breast isn't able to help the tongue form the palate. And the breast does help the tongue form the palate when breastfeeding is going correctly. So here's the connection between breastfeeding and airway because of that palate development, right? So we usually think of the benefits of breastfeeding as things like immunity, bonding, all that good nutrition. We're looking at microbiome now and all that good stuff. But I'm thinking that airway may be the most important because the way we feed shapes our palate. Now, your tongue was prevented from lifting, but maybe that's why you couldn't breastfeed.
Partially,
as a child.
I think my according to my mother, her production dried up pretty quickly within 6 weeks.
Yeah. And that was related to you not being able to stimulate her breast correctly. Of that.
That's fascinating.
Yeah. So as moms, we always blame ourselves. Right? Everything that goes and healthcare providers tend to blame the moms too. Oh, you must not have enough milk. Your milk may not be right. Maybe your nipples are too small or too big or shaped wrong. All these other things that they come up with. But a lot of times it's the shape of the baby's mouth or the inability for the baby to use their tongue in the way that they need to. So I thought that was really interesting when you said in your note to me that your mom had trouble with her milk supply. That's classic. That's classic.
I mean, it's really interesting to me that this information is developing because it's clear to me that what we know now, we didn't know when I was, a child and going through this, because I had 6 years of orthodontics in middle school and high school.
Did they take
No,
teeth
my
out?
mother wouldn't let them take teeth out.
Oh, good.
I did
Good.
have my wisdom
Smart
teeth
lady.
removed though.
Okay. All right.
But they tried everything. They got to a certain point where they said, "There's nothing else that we can do for you." So we took the braces off, and I went off to college. And then the weird thing was that I went to an ENT for my breathing, and then as I started down this rabbit hole, other things that had started coming up for me disappeared. So I had started developing severe anxiety, which was not something I'd encountered before. And of course, I was just like, well, I'm at university. I'm having an existential crisis. I'm sure it's quite normal. And I also started getting ice pick headaches, very sharp, severe, 3 to 5 seconds, no warning, in my kind of right around my temples.
Like a stabbing pain,
really sharp, severe stabbing pain. So I was exploring those symptoms separately. I was seeing a neurologist, and I was just kind of trying to figure out what was wrong with me. And as I started the therapy for my tongue tie, all of those symptoms went away.
When I began to work in this field, I quickly realized that school didn't teach me enough about tongue tie. I wanted the opportunity to learn firsthand from an experienced professional. I had so many questions. Can you relate? Good news. I've created the Professional's Guide to Tongue Tie in the Breastfeeding Infant just for you. You'll get 4 recorded video modules, downloads to share with your patients, admission to a thriving multidisciplinary community for networking, sharing, and continued learning, and 4 LSERPs. All the details are on the website at tonguetieexperts.net/pro course. Use code podcast15 to save 15% off this and all of my courses. Can't wait to see you in the group.
So a couple of things that you're bringing to light is the silos that our parts of our bodies are put in when we seek medical attention, right? I mean, you could have somebody looking at your head and they're not looking at your mouth. Right? You could have somebody, there's doctors for feet, there's doctors for, whatever, everything. Every part of us, right? And nobody's looking at the whole
and
picture.
Even after this, so I had orthodontics when I was in middle school. I had an ENT in my early 20s. I started the orthodontic treatment for my tongue tie. It was 4 years into that treatment where I've had myologists looking in my mouth. I've had maxillofacial surgeons looking in my mouth. I've had orthodontists looking in my mouth, where they recommended that I start taping my mouth at night to train myself to breathe through my nose. And I wasn't able to do that. So it was.
Yeah, I was going to say that could be dangerous if your nasal passages aren't patent enough to pass air, right?
It took me coming back again and saying, look, I'm trying this therapy that you're recommending, and I'm not able to breathe, for somebody to finally look at my nose in such a way and go, oh my gosh, the structure is wrong. You're not able to get air. So it's wild how that can get missed by so many people.
So how was your sleep growing up?
My sleep was pretty disordered. I had difficulty falling asleep, and I was and still to some extent I'm quite a violent sleeper. So I originally they actually put me up for a sleep study when I was in my early 20s, when we started doing this for the neurology element. And I ripped the entire apparatus off all 3 nights. And my mother used to say that I would throw myself out of the bed, that I was so,
Wow. Yeah. And that's related to not being able to breathe because you're suffocating at night. It's worse at night. So if you can't breathe during the day, you definitely can't breathe at night.
So yeah. Obstructive sleep apnea is the end result of having all of these structural issues, including tongue tie, but not isolated to tongue tie. As yours wasn't isolated to tongue tie, it was related to nasal passages and everything too. So again, we have to look at the whole picture. One of the things that I'm hearing as you're talking is that you realized once you started seeing the people that listened to you and recognized it, you realize that not everybody knows this stuff, not even the healthcare providers who are specialists in that exact field. Like you said, there are certain orthodontists that had no idea. There's certain neurologists, mostly neurologists, probably wouldn't know this, right? ENTs even vary in their education and what they quote unquote believe in, which I hate, putting the term belief like a religion into something like a structural issue like a tongue tie is. But that's what we hear. Oh, I don't believe in that.
Right.
Which is kind of sad. So you persisted and you found the right people. And that's important. And I think that's an important message for us to get to my audience, to realize that if you have an instinct that something's wrong, and your healthcare provider isn't answering your queries, isn't giving you the support or giving you solutions that make sense for you, keep looking.
Absolutely. Keep looking. I think there's this sense that an expert is going to have all of the answers and be able to assess you and give you a comprehensive diagnosis. But what I've found is, especially in this realm, that the lanes are very compartmentalized. So, for example, even though Dr. Raphael, who is wonderful, is an orthodontist, could look in my mouth and say, you have a tongue tie, he wasn't willing to formally diagnose me. I had to go see a myologist who could do the diagnosis. And then, so everyone kind of has their lane, and you as the patient, you really need to kind of look at everything and say, okay, this is where I need support. How can you all support me in this?
Right. So for an adult, I usually say you're calling it a myologist. We say oral myofunctional therapist is the longer way to say that for those who aren't recognizing the term myologist. For an adult, I feel like the myologist or the sometimes it's a speech language pathologist with specialized training in oral motor. They're like the quarterback of the team, because this is all about function, right? It's not like, so Dr. Raphael can look in your mouth and say, yes, I see a frenum there that appears to be such and such, right? It might be a tongue tie, but you can't really diagnose that it's a tongue tie until you evaluate how the tongue moves. And that's why the muscle specialist or the myologist is the one that is called in. And then he or she usually is the one to say, let's do this, this, and this, and maybe go see so-and-so and so-and-so before you think about releasing the tongue tie.
Because I think there's this misconception I've seen in some new parents forums, and absolutely no judgment. But this belief that you don't need to address the tongue tie in infancy because it's something you can take care of as an adult. And what I've found is that there are so many different little elements to the damage that having this tongue tie for 23 years did, that every time I think I get to a kind of goalpost, all of these other things come up. So I'm not even done with treatment right now. I'm still seeing a TMJ specialist because my jaw was locked and in so much pain. Once we started letting the other muscles do the work they were meant to be doing, my jaw was like, yeah, I've been holding all this tension for 20 years.
Right. Yeah. The challenge is, and in those new parent groups, there's lots of stuff I hear that, I could correct, but I could talk for an hour on that. But one of the challenges is that we don't actually have any proof that correcting a tongue tie young will prevent things, right? But we can look at what the symptoms and the problems are at the time and say, yes, we should do this because the function that's supposed to be going on right now isn't working, meaning eating and being able to breathe while you eat, nursing at the breast, then starting solid foods, having speech difficulties, open mouth breathing as a baby or toddler, which we do see, is all symptoms that something's not right in the airway. So we would never want to say to somebody who everything is fine and everything is all healthy and good, nursing fine, eating fine, speech is great, but it looks like a frenum, so let's cut it because we don't want to prevent things in the future, because we don't actually have the research for that. And there's been some controversy lately, and this is always a controversial field, but there's been a lot of bad press that makes us put our feathers up and say, wait, we have to be really careful here. Really careful.
I read the New York Times op-ed.
Yeah. So, lots of unfair things there, and I did an episode on the backstory of the doctor that was interviewed in that article and how little of the experience of the reporters in his office was actually reported, and how he does have research and he's creating research and he showed them everything and they saw happy patients and they only came up with a negative story, which is really sad. Really sad. But that's a whole nother episode. Have you ever wished you could help that mom who is questioning if she has enough milk? Ever wanted to either reassure her or know when to refer? As a lactation consultant, I created the program Understanding Milk Supply for medical and birth professionals to help you to feel more confident in those exact situations. This affordable, recorded video mini course is open to anyone who works with pregnant or breastfeeding families. It's a particularly valuable opportunity if you're an SLP or an OT who wants to gain an understanding of how breast milk is made, or a dentist in the field who is often the first-line provider for tongue-tie treatment. The function of the infant at the breast depends on milk supply. Even if care of the mom isn't in your scope, there are basic principles that you can learn that may rescue a family's feeding goals. In Understanding Milk Supply, I teach you what red flags to look for, when to refer, who to refer to, and how to advise the family in the meantime. And there's one LSERP included for lactation professionals. Go to www.tonguetieexperts.net/milk supply. The link is clickable in the show notes. And as always, you can use coupon code PODCAST15 to save 15% off this and all Tongue Tie Experts courses. Thanks so much. But I do think that, if we're going on the idea of function, you already as a child had functional deficits that could have been addressed if the right people were seeing you.
And they may not have been as obvious in infancy, or they were, but we didn't know. But even as I grew up, I remember having difficulty breathing in exercise or in recess classes in elementary school. And we just didn't know what to look for.
Yeah. I'm sorry. I haven't said that. I'm sorry that you had such a hard journey. I'm thrilled that you found your way, and I know it's a journey and I know it's a hard journey. And you are proceeding in a way that's going to make things better for you, but it's not easy and it'll be a lifelong journey.
I mean, I'm grateful to have discovered it when I did, because I think that was a stroke of luck, and that I probably could have lived with all of these disparate symptoms for much of my life. And I wonder how many people are living with these symptoms, not really understanding that they're connected. But it is, I mean, tongue therapy, learning how to lift that muscle that you've never, ever lifted, is a lot. It's very intense. And I think sometimes I wonder if I should have been more vocal as a child that like something was wrong, because I did know something was wrong. But when your baseline is, tongue-tied mouth breathing, you just sort of go through life thinking, okay, this is how I am. That was
your normal.
Exactly.
That's your normal. Yeah. 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 I mean, I can tell a similar story with my eyesight. I had strabismus. My eyes would do some funky things where one of my eyes would turn in, and they call it lazy eye. But I never had binocular vision, meaning my eyes didn't work together. And my brain did some cool stuff that made my deficits hidden in a normal eye exam. So my mom knew that there was something up my whole life, and doctors would tell her it was fine. And it wasn't until I was 19 that I found someone who actually understood what was going on. I had surgery. My eyes don't work properly, but they don't, unless I'm really tired or sick, my eye doesn't turn in a funny way anymore. But that was my normal. So you know how I knew, right? So there's things that you're like, oh, I guess you can't, I don't know if you are too young to know this, but those viewing things we used to look in, you put right. And they'd be you look in and you see a 3D image, and I would see two separate pictures.
Oh, wow.
I never saw the 3D image. I can't see 3D, I can't go to a 3D movie and I can't see it. I just can't, because my eyes don't superimpose the images. So that was my normal. And I couldn't explain that to anyone, just like you were just talking about the breathing, right? It's just I guess this is just how it is.
You don't have the language. And especially when you're a child, I feel like you are learning how to exist in this world as a human. So if you have a bunch of adults telling you, yeah, we checked and there's nothing wrong, you accept that as fact.
Right.
Because they're grown-ups and they know better.
Yeah, it's really so. How did you finally discover that you had?
So I had just finished university. I went to university in Scotland. So I had come home, and I was just not well. And it's a period of your life when it's very transitional, and so there were all these other things going on. And I knew that my health care was going to run out soon. So I decided to really address this. And I found an ENT, and she was hesitant to do nose surgery as to fix what she saw as an impaired breathing airway, without somebody looking at my mouth, because she very rightfully believed that whatever was going on in my nose was directly related to how she saw my bite, which was and is an open bite, and always will be an open bite. And so thankfully I found Dr. Barry after that, and we got the ball rolling. And
did you eventually had the nasal surgery because you needed
but the thing was, and I don't want to put this ENT on blast, because she really did lead me down the right path, but she looked at me in 2017 and didn't notice that my nasal valves were collapsing in on themselves when I breathe. Wow. So I started correcting the tongue tie. I had the frenectomy, I had a lip tie. I was in an ALF appliance for 3 years to widen my palate.
And that's a palate expander for those who don't know. And that's not so comfortable.
No, there are more comfortable things. And it's a bit of a paradox, because you are in, myofunctional therapy to learn how to lift your tongue, and you're getting all these directives to rest your tongue at the top of your mouth and find a comfortable place in your palate. But at the same time, you have all of this metal at the top of your palate in the way. So right? It was a bit of a dance. And after.
And how long was the ALF appliance? How long did that?
3 years.
3 years. Wow.
And after we finished with the ALF, I went into aligners and had submandibular hooks installed in my jaw, which I do still have. as a way to try to close my bite down, which was ultimately unsuccessful, unfortunately. So at this point, we've sort of hit a roadblock where we've done all we can structurally, and now we're going to try to treat the ongoing TMJ that I have. Another random side effect of this is that my gums are receding down here from all of the tension that it takes to close my mouth.
And that's common. That's common. Yeah. So one thing I want to say is you might not have had all the structural things because there are things that are evolving right now that you don't know what's going to be available next year. Which is really cool with this field. And I'm learning, I mentioned the documentary we're making. And since we started filming a few years ago, there are already advances that they have to go back and say, no, now we can say this instead of that. So you never know. But symptom wise, how much are you improved?
Dramatically from where I was in 2017. I haven't had an ice pick headache in 5 years. I would not consider myself an anxious person. My sleep is fantastic. And I am learning to breathe through my nose, but I do have pretty near constant TMJ. I did start treating that with Botox injections, which I was very hesitant about, and I know is quite controversial, but I did find that my masseter muscles didn't know how to relax because they'd been tense for so long. I could send the signal from my brain to the muscle relax, and it wouldn't do it. So that was an immediate relief, and it kind of taught the muscle, this is how you can, untense and relax. And I've been in cranial sacral therapy. So my kind of posture and just in general, the way I've been carrying my neck, has improved dramatically.
I love cranial sacral. It's
wonderful.
Therapy. I think everybody should
Absolutely.
have it once a week. Yeah. And I say when parents ask me when I'm explaining to parents of babies what it is and why they should have it or why they should, look into it. And they say, well, what is it? And I always say, well, to me, it's magic that really shouldn't work, but it does. Right? If you're a medically minded person and you think of this, it really shouldn't work. The same with homeopathy. I love using homeopathic remedies and they should not work, but they do. So it's one of those things that it's just, I think it has to do with, and the CST providers that are trained and know that there is scientific basis to it. But to me, it's more about the laying on of the hands and the energy that we share and moving energy around. And even though that's not what they claim to be, in my opinion, that's what's the most effective about it.
And
that energy.
In some ways, that's kind of why I'm so grateful. I've come to this place of gratitude for having this tongue tie and discovering it, because one of the best side effects is that I was holding energy in my body in very tense places. And I can't say, oh, it's because of my tongue tie, but I have a very strong intuitive sense that, my vagus nerve was understimulated my entire childhood, and that it created a normalcy for me to be in my sympathetic nervous system.
My
fight or flight.
Flight and fright. So was always
exactly
active.
So once I started peeling that back, I have found just a peace within my own body that I didn't know was possible or normal for most people.
That's beautiful. And I think so many of us are living in that state, and the tension, whether or not it started at the tethered tongue or started somewhere else, if there's tension somewhere in the body, there's tension everywhere in the body. And that's something that I've come to realize, and I can see it in newborns that are, I hate to use the word dysfunctional, but they're being dysfunctional in their movements at the breast. it's because they have tension somewhere else, maybe from a position in the womb, maybe from the way they were born. But it's interesting. You can see it already in infancy, in toddlerhood, and childhood if it's not resolved. So I think this type of body work or manual therapy to help relax everything it's one of the most important things we can do for our kids. So Noah, one of the things that you mentioned that there's been an article that brought some bad press into the field of tongue tie. Let's just put it that way. To me, that bothered me for many reasons, but one of the reasons was that I was afraid that parents who did need intervention or their kids did need some help would be hesitant to because of the bad press, right? What's your take on that as an adult? How did you feel when somebody's saying something that helped you was this bad thing, that nobody should be doing?
It's a very unique feeling because I'm not a professional doctor. I have no licensing. I have no, accountability when it comes to this from a medical standpoint. All I have is my own experience. And for me, I try not to think too much about what my life could have been like if this had been caught when I was growing and had the ability for my whole system to kind of grow more correctly, I guess. Mm-hmm. But it's very, very, very frustrating for me to see parents who have the ability to identify this issue, but are being told that there isn't enough of a benefit or enough of a reason to traumatize your child by cutting into their mouth at that age. And, my unsolicited opinion is sort of, if any amount of tongue tie existed, I would want to address it because I know all of the potential nefarious ways that it can kind of grow as you grow. But, I'm not a mother and I don't feel like I have the, ability to kind of come out with pitchforks and say, this is all wrong because I don't.
Right. Yeah. But you aren't a medical authority, but you're an expert because of your experience, and this is the Tongue Tie Experts podcast, not because I'm an expert. It's because I interview experts, and you are an expert because you know more than most medical professionals know about this topic and diagnosis and treatment options and what worked for you. You are an expert. So I just want to say that to you.
Appreciate that.
I am so grateful that you were open enough to share your experience with us.
Absolutely.
Because people need to hear these stories.
Yeah. And I think the messaging that I would give to young parents in general is that this isn't a quick fix when you get older.
Amen.
You
Amen.
really don't know all of the different systems it could affect. It's mind-bogglingly expensive, and it is a full-time job that I'm showing up for. But I'm not gonna lie, like I don't. I try not to think about what my childhood could have been like if I'd had this corrected. I also try not to think about what my 20s could have been like if I wasn't dealing with all of this. So, yeah.
I'm someone who likes to believe that we are where we're supposed to be at the time that we're there. Yeah. So I have a feeling that there's some reason somewhere for this, for you. Maybe it's advocacy. Maybe it's, who knows? But just the fact that you're sharing this story is going to help other people. And again, I'm so grateful for that.
I'm so grateful to be here.
I think that I don't want to get emotional, but I feel what you've been through. And I think that it's someone like you who has had their symptoms resolved by treatments related to this type of procedures and orthodontics and injections and exercises and all the things that you've done is the best person to give an account of what's possibly started in infancy and what you can possibly prevent by looking at the function that your child is doing at the time. So if there's a functional deficit and somebody says, I can help you fix the way that tongue moves, and it's not a quick fix of just clipping the tongue, but go to the functional experts. For an infant, it's usually an IBCLC or an SLP, speech language pathologist, feeding therapist. But don't think that breastfeeding is selfish, which I've heard. It's not selfish. It benefits the baby as much as it benefits you. If both, it's not a quick fix. It can be a little bit of pain. It's definitely a difficult thing to put your child through something at any stage, but you're helping that baby to full function, right? And that's why you did what you did, right? Like you're trying to, it's worth the effort and the discomfort because you're getting your function back. And what's more important than breathing?
Really, really. Yeah. And I do think that's like the single most important takeaway is make sure your child's breathing correctly, because when you're a new human in this world, you don't know what is optimal. You just kind of exist. So be curious about that and make sure that you set your child up with the best foundation to breathe.
Right. Simple, right? Simple. Breathe through your nose. Not always so simple. All right, Noa, thank you so much for being with us today. And is there anything you want to share with our audience? Do you have a website or anything that would be pertinent to my audience?
Oh,
if you want to promote something, we can do that. We can do that in the show notes if you want to think about it.
You can reach me through my website, which is more of my creative direction website at noabricklin.com. That's NOABRICKLIN.com. And you can contact me there, and please feel free to use that if you have any questions about my experience, or if you'd like any recommendations of practitioners that I've used. I'd be happy to disseminate that. I think it's so important.
Beautiful. Thank you so much, Noa.
Yeah.
Have a great day.
You too.
Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Tongue-tie cases can be confusing, but what if you had a place to ask questions, learn from experts, and connect with professionals who truly understand? That's exactly what you'll get when you join Tongue-tie Experts Insiders. It includes monthly online meetups with me, Lisa Palladino, expert guest speakers sharing the latest research and best practices, a private community of other professionals ready to support you every step of the way. For just $19.99 a month, you'll never have to navigate tongue-tie cases alone again. Join the community today. Your future self and your patients will thank you. Sign up now at tonguetieexperts.net/insiders.